Good afternoon, Madam Speaker. Madam Speaker, we're less than a week away from a strike by long-term care workers across Nova Scotia. Long-term care workers have been telling me they don't want to strike, but they can no longer afford to pay their bills. They make $1.50 more than minimum wage, many after 10 to 20 years of service. The minister could prevent a strike today by presenting a fair raise to long-term care workers. We've heard many times today from ministers they value healthcare workers. So if that's the case, will the minister avoid the strike by offering a fair deal this week, or is the minister simply going to let this strike happen?
I recognize the Honourable Minister for Seniors and Long-Term Care.
Thank you, Madam Speaker, and thank you to the member for the question. So everyone knows as a healthcare worker that I highly value everyone who works in long-term care, to the point where we have an entire department dedicated to long-term care, which is the first in the country. The Premier made that decision. He also made the decision to ensure that the staffing level in long-term care was the highest in the country. What I do want to say to all of those members who are potentially impacted by this is that the offer that was made is the exact same offer that was made to acute care workers who accepted the deal, including CUPE union members. It is the exact same deal that was offered to home care workers who accepted the deal, including CUPE members. It's the exact same deal that was offered, and over 23 other long-term care facilities have already accepted the deal.
I recognize the Honourable Member for Halifax-Armdale.
Madam Speaker, regardless of the deal, it's not working. We're going to be on a strike next week. No matter what the minister says, we know a strike will mean a reduction in staff. This comes from several CEOs I spoke to this morning in nursing homes. There will be no kitchen staff, no housekeeping staff, no laundry staff. Without them, the risk of infection will go up. As we've learned from COVID, infections are a serious threat to seniors, and in a nursing home in particular. It can spread quickly and it can be catastrophic. Nursing home staff have told me they cannot do their own job, plus the kitchen, cleaning, etc. Is the minister prepared to prevent a strike that, without a question, will put seniors' health at risk in Nova Scotia?
I recognize the Honourable Minister of Seniors and Long-Term Care.
Madam Speaker, I'm almost speechless that a fellow health professional would suggest that we are putting the health care of seniors at risk. He should know better. So the first thing you learn in medical school is, above all, do no harm. So let me reassure all Nova Scotians that our long-term care staff care so much about their clients, they are going to make sure that that care is provided. As a matter of fact, there is a legal requirement called an essential service contract. But, Madam Speaker, what the member just suggested, there's not going to be any kitchen staff, there's not going to be any of this, is just factually incorrect, Madam Speaker. And what I want everyone in long-term care to know is that we have offered a fair and competitive deal that acute care workers, home care workers, and every other long-term care organization.